This morning feeling risky. I had been patience and calling sick, but I end up in Jolly's pharmacy. And don't think I treat Jolly's system, my immune system. Me feeling fit and strong, now I'm ready to work like it's on any mission. If you see me forget, Jolly's pharmacy is number one, Jolly's forget. We cater for everyone, Jolly's forget. The immune system, Jolly's forget. Yo, Dominic is the boy father box. Whenever I'm in town and I'm feeling down, I head to Johnny's Pharmacy, then boost me up real quick. Johnny's Pharmacy, leading the way in healthcare. Introducing Johnny's Pharmacy, brand new website, www.johnny's.gm. It's your time to jump the line. Shop now at johnny's.gm and have your items delivered in the comfort of your office. No more standing in line. No need to use your lunch hour to shop. Hassle-free shopping, safe and secure. Johnny's.gm features rush delivery, 1 hour. In-store pickup, regular delivery, 5 p.m. Cut-off time, 4 p.m. It's your time to jump the line. Visit us at www.johnny's.gm. Johnny's Pharmacy, leading the way in healthcare.
Good morning, and welcome to another episode of Health Vibes, where we always give you a little bit of health education with vibes. It is a glorious Wednesday morning here in the island of Dominica, and we are with you as usual, Team Jollies, in the studios of Q95 FM Radio. This morning, I am joined by Leona. Leona, good morning to you.
Good morning, Shirley. I'd like to bring you a lot of vibes, what's going on. I would like to say a wonderful day and a wonderful Wednesday to all of us.
Yes, Leona, it's a very wet Wednesday, rainy in the city of Roseau. I'm sure maybe rain elsewhere. And in addition to the rainy conditions today, there are 2 cruise ships in port, one at Woodbridge Bay and one, of course, at the Roseau cruise ship terminal. And so it's a very congested Roseau. If you're in Roseau, lots of traffic, and lots of movement in the city. So if you're in Roseau this morning, I wish you well navigating navigating the Roseau traffic. But I mean, I'm sure there are many people who are very happy that there are 2 ships in port.
Indeed.
The vendors and the tour operators,
Definitely
taxi drivers.
the tour and taxi drivers, because
Yes.
there was lots of boats, lots of traffic, very little buses on the regular routes.
On the
today.
regular route.
Yes.
Ah,
So
okay.
I know we're quite happy about the influx of that really large cruise ship there.
Yes. So all the best to you if you're trying to do business in the city this morning. Also, of course, this is the last week of November. We're wrapping up November in the United States. People are gearing up for Thanksgiving, which will be on Thursday. So it's holiday season for them. But for us here, not quite, but we are getting ready for December, which of course will mean the Christmas season is going to be upon us. So here on Health Vibes, we have lots of plans for the month of December for the program, and we're looking forward to a good Christmas season with you all, our listeners, our constant listeners, our new listeners, to Health Vibes. So the Christmas season is coming up. Leona, are you a very big Christmas person?
Definitely a huge Christmas person. I think
Okay.
I got it from my mother. She's usually one of the real decked out Christmas, everything changed, biggest, cleanup of the year, all the curtains, everything all up. And it always gave this sense of togetherness during the season. I think it's so much more than just we have the Christmas on the buying and selling side, but it's so much more than that, because at home Christmas was always about all of us doing this together, whether we it be we painted the house, or
Mhm.
we all put up decorations or whatever the case may be. So it's a great time for my family actually.
Okay, yeah, nice family time. I must admit, I used to be more into like decorating and that type of
Mhm.
stuff, and I feel like right now I'm just too tired to
Mhm.
do much of that type of thing. But it's definitely, a nice family, family based, family oriented season, and a season to give back as well and to be thankful for the blessings that you've received. So I do look forward to the Christmas season. I know at Jolly's, it's always a celebration for Christmas, and Jolly's tries to do it big for the children during the Christmas season. So I do know that there are Megaland plans
Mhm.
down at Jolly's Pharmacy, a Megaland at JP Mega in Fokole is coming up, and of course in Portsmouth as well, because we don't forget our people in the north. Megaland in the north is also coming up. So what's the dates? What are the dates, Leona?
Well, for those of us who anticipate Megaland every year, and I know that's a lot of us, the
Mhm.
first one will be in the north, and that will be on the 6th of December. So that's coming up pretty soon.
Mhm.
And that will be from 2 p.m. to 6 p.m. So feel free, cut out that date for your children, for your families. We like to see when the adults come along and participate as well, alongside your kids. So that will be on the 6th of December. And then we have JP Megaland in Jolly's Mega. That will be on the 13th of December. Same time, 2 to 6. So bring the
Mhm.
children along. It's a free event. They come to enjoy themselves. Most times they are able to play with their friends. You might notice 1, 2 adults who know each other, and you get to
Socialize.
socialize and,
Uh-huh.
and stay around. They have the bouncing castle in there. They have treats, they have prizes, they have games. So feel free to bring the children along
Mm.
to Jolly's Megaland on the 6th in Portsmouth and the 13th in JP Mega at Fokole.
Focally, yes. So that is something definitely to look forward to. So for all our listeners, if you have children, if you are not if you only have children, but if you know
Mhm.
children, godparents to children, aunts or uncles to children, you need to mark your calendars. If you're in the north, December 6th, if you're in the Roseau area, Roseau and environs, December 13th. Really a time to let the children enjoy the season right at our Jolly's locations. So make sure you mark your calendar. It's something nice you can do for a child to take them out and let them experience all the games and all the activity that is lined up at Megaland. Megaland is always good. As a matter of fact, Leona, I used to, anytime I cover Megaland, I say to myself, boy, we need to have like a Megaland for
I
adults,
would say,
for us to get
mhm,
into the games and so on.
mhm.
So I look at the children very grudgingly. Like, we are the
I
big size
always, I
bouncy
always have
castles.
right. I always have this thought that I wonder if two of us go into that. If we can deflate. So definitely put that in the books. That's something that can be maybe thought about. But
Yes,
take the opportunity either way.
an adult Megaland.
Mhm.
Yeah, Leona, and what else in terms of I know for Jollies and for the wider public,
Mhm.
of course, there is the 16 days of activism that people are recognizing as it relates to gender-based violence.
Mhm.
Anything special at the pharmacy on that level, or just recognition of the days?
Typically, we are really trying to boost awareness because it's something that not only affects, you hear of these big stories and you hear about, bigger things in the Middle East, but we have a lot of this here as well.
Mm.
And, it's gender based violence. When we speak of this, we're speaking particularly against women and children. So that is what yesterday would have brought awareness to, and that's the 25th of November. So yesterday we were all across all our locations, we were dressed in orange,
Okay.
and that's the color that boosts awareness and basically says that you are supporting the ending of violence against women and children.
Mm, mm.
And so we had our males who wore their orange, our females, the office, the pharmacy, the floor, everywhere who were really decked out in orange to show support in terms of stopping this type of violence. And for this year, the theme is based around digital violence.
Yeah.
I know that's something that sounds very weird because what is digital violence? Essentially, right now we're in an era where technology is kind of, superseding everything else. And right now, because of the access to technology, you can literally get bullied from anywhere, from anyone. And we have a lot of that now. We see that in the schools, in the high schools, in the primary schools. We even see that in adult life as Dominicans. A post goes up, a video is shared of someone in an inappropriate way, and the entirety of the nation is now bashing this person or talking about this person. Persons are sharing this person's address, this person's telephone number, and we are here, putting all this negative energy. And most times what happens is, with this, you have persons who then get physical harm from this. Because imagine now you are treated as a pariah for one way or the other, whether it is you have maybe a physical defect, someone doesn't like you, they spread lies about you, and then if somebody sees you on the road, they decide they want to physically harm you. Or a man wants to now sexually abuse you, all of these things. So these are things, or that's what it's geared towards this year. So we want to stop all violence amongst against women and children. This year we're really pushing to make the technology side of things online. There's no excuse for abuse, and that is really the hashtag that we're going with. No excuse for abuse, one way or the other.
So if people were not aware of the 16 days of activism for gender-based violence and the campaign to end the violence against women and children, now you know. So if you saw people dressed in orange yesterday, that is what that was about. And I do hope that more people, of course, can join in on the campaign and do their own thing in their own way to raise awareness and to try to diminish or reduce violence against women, children, and of course the digital abuse that you spoke about, Leona, which is so prominent now. So I do hope that people can join in. Leona, I do see we have our social media followers popping up. I want to give them a special shout out, as I usually do. Julie, good morning to you. I see you're logged on, and all the others who are popping up. So you can tune in to view the show on the Q95 FM's Facebook page or YouTube channel. So if you're home and you want to look at the show, you can do so. We do have a guest in studio. We have a very interesting topic lined up. I don't think we've ever had this particular topic here on Health Vibes. And so we're very excited about that. The guest is waiting. So if you're viewing us on social media, you already see who we have in studio. If not, you're still in the dark, but soon you won't be. What we're going to do is we're going to take a quick break, and when we get back, we will introduce our guest and we'll start the ball rolling on our topic for this morning. So make sure to stay tuned, and we will be right back.
Charlie's Pharmacy is bringing vibes to health with Health Vibes. Health Vibes. Each and every Wednesday from 10 to 11:30 a.m. with your hosts, Trudy Kristen, and co-host pharmacist Jacinta Fagan and Leona Jeremiah. Education, information, and a bit of humor. And not forgetting lots of vibes. Jolly's Pharmacy is bringing health and vibes together with Health Vibes. So be sure to tune in each and every Wednesday on Q95 from 10 to 11:30 a.m. Jolly's Pharmacy, leading the way in healthcare.
Started feeling missing. I had the intentions of calling sick, but I end up in Jolly's Pharmacy. And don't you touch me, Jolly's system, my immune system. Me feeling fit and strong, now I'm ready to work like a can any mission. If you see me again, Jolly's Pharmacy is number one, Jolly's forget. We cater for everyone, Jolly's forget. The immune system, Jolly's forget. Yo, Dominic, it's about the box. Whenever I'm in town and I'm feeling down, I head to Jolly's Pharmacy. They boost me up real quick. Jolly's Pharmacy, leading the way in healthcare.
Introducing Jolly's Pharmacy, brand new website, www.jollys.gm. It's your time to jump the line. Shop now at jollys.gm and have your items delivered in the comfort of your office. No more standing in line. No need to use your lunch hour to shop. Hassle free shopping, safe and secure. Jollies.tm features rush delivery, 1 hour. In-store pickup, regular delivery, 5 p.m. Cut-off time, 4 p.m. It's your time to jump the line. Visit us at www.jollies.tm. Jollies Pharmacy, leading the way in healthcare.
And we are back with you. And this morning, as I said, we have a guest in studio and we're going to be discussing a very interesting topic. We oftentimes hear about birth control, contraceptives, a lot of terms thrown around preventing pregnancy. What is that? Another big thing, a lot of times that is spoken about is emergency contraceptives, and of course referred to as well as Plan B. We haven't had a discussion on this on Health Vibes in the past. I don't think we have discussed reproductive health as it relates to contraceptives at all on the program, well, at least from the years that I've been on. And so this morning is a special morning because we get to discuss that with the guests that we have in studio. So we have with us Natasha Gervais Carbon, and she's the executive director at the Dominica Planned Parenthood Association. And she has graciously given consent to be on the program this morning. I had to tell Natasha she needs to be on with us on this topic. Natasha, good morning to you.
Good morning, Trudy, and thank you so much for having me. Good morning, Leona.
Good morning.
Past students, it's a pleasure to be here with
Yes,
both of you.
I'm with two of my past teachers.
Oh, wow. So
Quite exciting to be
Mhm.
here. I have been kind of docking Trudy a little bit, but Trudy has a way of ensuring that she gets what she needs to get.
Mhm.
I'm really happy to be here this morning.
yes, I wanted to, this is a topic, a conversation that I have wanted to do for a while, but particularly when I see certain misconceptions or certain things on social media about contraceptives, about particularly Plan B, I said, it's really important for us to have a nice discussion where we can speak about some myths, set the record straight on certain things, and get people to really understand what's in line with the contraceptive methods that are available and what's the right way, what's the wrong way as it relates to usage. I'm going to start the ball rolling with a very funny story. I don't know how many people follow Asa Banton on social media
Mhm.
and have seen his storyline with Brownie,
Brownie.
right? I don't know how many people have been seeing that, but in the storyline that Asa Banton has with Brownie, there was a pregnancy. Brownie was felt to be pregnant, and Asa tried to access the emergency contraceptive Plan B for Brownie. Now, this was very interesting because in this particular scenario that Asa Banton was showcasing, Brownie was already pregnant,
Mhm.
and he was searching for emergency contraceptive Plan B. So I want to start with us kind of defining what is emergency contraceptive. What is the emergency contraceptive, or what is this very famously referred to Plan B option for preventing pregnancy? What really is it? So, Natasha, I will go to you first, but I do know Leona, the pharmacist, does have something for us about what really is it. What is it? What does it do? What is it meant to do?
Well, I'll start by saying that if Brownie was pregnant already, it's no longer an emergency and it's a little too late. So my disclaimer here, I'm not a nurse. And so I'm coming from a background of working in the contraceptive field where, yes, I manage Planned Parenthood, but I have a basic understanding of how everything works. And there is no, when it comes to medical stuff, truly, there's no right and wrong way. It's always a discussion with your doctor, a discussion with your health professional, and you let the professionals guide you because there's no cut and dry for everybody. So everybody has different symptoms, different effects, or we may have the very same symptoms, but our backstories are so different that the doctor would have to determine. So basically, the information we can provide here would be the general information about what the contraceptives are and how they are supposed to operate, but it's not cut and dry for everybody.
Right.
So that's basically my
Yes.
my disclaimer. All right, there's no one way for everybody. All right, so basically, an emergency contraceptive would be a single dose pill that is taken as soon as you have unprotected sex.
Okay.
And so we had sex last night. This morning, I need to go to the pharmacy and I need to get my backup. The best thing would be to have already be on some form of contraceptive or to use a condom. However, life happens, we get excited, things happen. And so sometimes we need a little bit of a backup plan. And it's just what it said it is, an emergency pill. And so it does not work very far along. So when you wait 5, 6, 7 days, the effectiveness of the pill becomes minimal. You have to try to take it within 72 hours of having unprotected sex.
Okay.
And unprotected sex may mean that you may have had a condom on, but it breaks. Or you may have forgotten to take your regular contraceptive pills and you realize, oops, a whole week passed, I wasn't taking it, or I missed a couple of days. And so you look for what you call just an emergency, it's like a little ambulance coming to your rescue. But the longer you wait, the less effective it is.
Okay. So we're talking about a method that is meant to prevent pregnancy in the event of unprotected sex and you not having coverage by another contraceptive method.
That's correct.
essentially. So a man and a woman have unprotected sex, vaginal sex, and there is the possibility that there may be fertilization coming out of that episode of sexual activity between the two, and the woman wants to prevent pregnancy. So, both of them maybe want to prevent pregnancy, but the pill, the emergency contraceptive, is something for the woman to take, correct?
That's correct.
Right.
And even a case where, for example, we have couples that practice the rhythm method.
Mhm.
So they mark the dates and they mark the calendar. But life happens. We get excited. We may mark the dates and it might not be, or tonight might not be the correct date, but you want to have a little sex and have some fun. And so it's one of the backup methods that would be used to assist. However, nothing is 100% effective. It's one of the least effective methods. It's 75 to 89% effective. Because again, remember, it's a backup. It's like an ambulance. It happened already. Things happen. And also, it depends on the time of month for the lady. So if you're ovulating already, it's not going to be effective. So by then, the egg has been released. The possibility of getting pregnant is higher. And so you also have to be very careful with not just, okay, I have sex and I'm going to take a pill because you can still get pregnant even if you take it right after, if you are that time of your ovulation cycle.
Okay. All right. So of course, for ladies, the reproductive women in reproductive age, an egg is released once a month. That is the norm. Of course, as you said, Natasha, it's not this everybody, different strokes for different folks.
Exactly.
Some people don't ovulate once a month at all. But the norm is once a month, middle of your cycle, an egg is released, and if there is the presence of sperm, that egg can be fertilized, and that's how all of us who are here on this earth, that's how we came about. Yes, that's how we came about, right? For the fertilization of an egg, and of course the development of an embryo and then a fetus, and then we were born. So we are products of this process, but sometimes people don't want that process to go through, and so you want to stop it in its tracks. But you're saying if the woman has already released her egg, she's already ovulated, then the emergency contraceptive will not.
Or the likelihood
is less
way
that
less
it will work.
than it will be.
Okay.
And of course, you just mentioned that everything is things are different for different people. So there are women, of course, because of whatever medical condition, whatever hormonal imbalance, they don't have regular periods, and so these women have to be even more careful because it's easier for you to get, because you cannot track it.
They don't know when. You don't know when.
You don't know how. And then you have women in like perimenopausal stage who begin having irregularities. Your hormonals are changing, and it's sometimes difficult, especially when you hit like 40. Things start to happen differently, so it's a little more difficult to track. And so at this point, you need to be a little bit more careful, a little bit more intentional. And the little whims and fancies, and we go have fun. We need to be more aware of what we do.
Be more careful.
More careful, yes. Because remember, it's not the regular for you. And with any changes, it will affect the effectiveness of the pill.
Okay. All right. Leona, I want to switch to you now on the pharmacy side of it. What is the drug actually? Plan B, or the emergency contraceptive. What is the actual drug, and what does it do? What is it doing in the body to allow the functionality that it has, which is to prevent pregnancy? Of course, we just heard it's not the most effective method at all. The effectiveness is lower than some other contraceptive methods that you can use. But what is the drug in that Plan B? How does it work?
All right. So to introduce the drug, I'll introduce another nickname. So we normally hear it by morning after.
Oh yes,
exactly.
Right.
yes,
in
Leona. The morning
pharmacy.
after. The morning
So,
after.
the morning after in the pharmacy. And so what is in there really is a drug called levonorgestrel. So now the levonorgestrel, and if you pay attention to your contraceptives, you might see that on your usual regular contraceptives, which we would determine would be Plan A, right? So Plan B, what's in there is levonorgestrel, and it's a higher dose or much higher dose than what you can find in a regular, cycle contraceptives. And what that does, essentially, it blocks certain processes in your body. And when that does that, or it's a progestin, so it mimics progesterone, which your body naturally makes. Now, when it blocks certain processes, right? And I'll leave it at that because I really don't need to go deep into it, but when it blocks certain processes, what happens is that it interferes with the rise of hormones. And so the release of the egg, and that's when we talk about ovulation, there is a delay, right? So it does not release at the time it would. There is some form of delay. Now, something that is important to note is that if you have unprotected sex, or for whatever reason, sperm enters the vagina, sperm can live there for a bit of time, about 5 days, right? So that means you could have had sex today, and you could have had some fertilization event, day after, tomorrow, and at least I think the least amount of time is about 30 minutes, which is pretty fast. So that is amazing to say that you could have a fertilized egg, right after sex. You could have a fertilized egg within a couple of days because the sperm is still active and still moving in that time, right? So that's why we have somewhat of a window in which we can kind of get the ovulation process to halt, so that we can ensure that it doesn't get fertilized. Now, like Natasha rightfully says, if ovulation has passed, right? So if you're in the point in your cycle where you have already ovulated and then you have unprotected sex, at this point, the emergency contraceptive cannot do much, right? You'll see a lot of differing evidence based on what it affects. So some sources might tell you that it hinders fertilization. So that would be the sperm now coming into contact with the egg, right? Some sources would tell you that it makes implantation a bit difficult. But the only source that really has enough evidence to back up exactly how that drug works would be to delay ovulation. And that's important to note, because that means that you really have to time taking this based on your ovulation cycle. So there's not much it can do for fertility, and there's not much it can do for implantation. So if you've already released an egg and it has come into contact with sperm, and you take this emergency contraceptive, more than likely, nothing happens. If you're already pregnant, the pregnancy can go on as normal. It is not an abortion type pill.
Yes.
So it will not hinder the pregnancy. It will not make implantation more difficult. If the egg has already implanted itself into the uterus, nothing happens, right? So what happens too is we might notice 1 or 2 women who come in a lot, and they're taking this. If you understand how this drug works, then at certain times when these things happen, you don't even need to take the drug, right? So you need to know, as a woman, you need to understand your cycle, especially, and this goes for persons who have regular cycles, because there's a lot of people who have irregular cycles, so you're not even sure what's happening. And that's why we have tools like, sometimes we have the ovulation kits that you can get to see, if you might be ovulating at the time. That's a tool that you can use to check. But really and truly, if for instance, you're in the stage of your cycle where you've already ovulated and a few days have passed since you've ovulated, you have unprotected sex, at this point, it makes no real sense
to take
an emergency contraceptive. And because we don't understand that, mostly as a nation, you find yourself taking emergency contraceptives 3-4 times in a half year. You know, by the time the end of the year, you've probably taken it 8-10 times. And not that there's any true evidence to say how much is too much. We try to advise that you end up in this situation as least as possible.
Right. So, Leona, you addressed a very important misconception that I wanted to make sure that we address on the show, which is the one that the morning after pill, the Plan B, the emergency contraceptive pill is an abortion pill. That is a misconception that a lot of people hold. As a matter of fact, it is very controversial oftentimes, the use of that pill, because of that misconception that, hey, if you're taking that, you are actually causing an abortion to occur. So a lot of people have that. I've heard it, as I started off the show by saying I've seen it in skits and comedy things that are being passed around. Hey, I'm pregnant, emergency Plan B, morning after. No. So we say in here categorically on Health Vibes that this is a false thought that if you are pregnant, the emergency contraceptive pill will knock off the the fertilized egg or the embryo, or it will cause an abortion to occur. So we're saying that is not how the pill works. Yes.
Correct.
Okay. There is, I think, just for information's sake, there is medication. There is a pill, which is the abortion pill that is used. Abortion is not legal in Dominica, but is used, for instance, if somebody has a tubal pregnancy, ectopic pregnancy, and the name of that drug, Leona, is what?
Well, that drug is widely known as misoprostol. And what it does, the main use of the drug is actually for gastrointestinal purposes. Right? So that's what the main use of the drug is. But legally, if you have an ectopic pregnancy, so when the child develops in the fallopian tubes as opposed to the uterus, and that can cause fatalities, they have to use that drug to then stimulate the uterine muscles to expel, right? So all the muscles in that area to expel. Now, really and truly, we do have conditions where persons have they have miscarriages, incomplete miscarriages, where that drug is used, often in hospital settings under monitoring, because there are, effects that can come because of this. So these drugs, persons tend to, want to just get access and take it. And no, most times these things involve either hospitalization or follow-ups, and definitely abdominal scans, because at that point you need to know if all of the tissue is cleared, because that tissue, so long as it's no longer living, the pregnancy is no longer viable, it's dead tissue inside of there, and that can cause a lot of damage. It can cause you to lose your womb, it can cause you it can cause death even, infection. Right? Infection. And that's one of the biggest things that doctors look at when you're having things like miscarriages, the risk of infection. So never, if you feel you're having a miscarriage, or if for whatever reason that's what you're wondering about, never do that on your own. Always get a medical doctor involved in terms of finding out what's going on with you. If you think you have been pregnant, sometimes persons are pregnant and then they take the test again, or they notice they're not pregnant and they just figure, okay, well, cool. No, you get that checked, because you never know if you have remnants of that tissue is still inside of you. Right. So that is what that drug would be. Sometimes mifepristone will be used alongside it as well to help the efficacy of misoprostol.
Okay. Right. So we just clarifying that what with the Plan B or the morning after pill is not this aka abortion pill, and that's a totally different thing. And if somebody is already pregnant, the morning after pill will not prevent the continuation of their pregnancy. We spoke a bit about the when can you take it. It's called the morning after pill, kind of presumptive that the sexual encounter happen at night.
Before you even continue with that, right? We've had a lot of fun stories in the pharmacy. We've had a lot of fun moments. And sometimes we'll joke with the customers a bit, and they laugh. But a lot of people come in really thinking, and you get a lot of young people, young men particularly, Because I feel like young ladies tend to understand the morning after faster because we are the ones swallowing it. So most times either we go in for it or we ask about it because that's my body, right? But a lot of young men, they come in and they ask for the morning after, or they tell you, I've had somebody tell me, you have any morning afternoon? Or even, those kind of things, right? Or you'd be like, you have any morning after, and you'd be like, okay, we'll tell him, when it happened and whatever. And he'd be like, yesterday afternoon. So does that mean it will work because it happened in the afternoon? Right? So these kind of things, it's just a fun way of saying it's a drug that's used post the issue. So for instance, you have sex, you have some form of exposure, whether it is that the condom broke or whatever the case may be. You have exposure and it's taken after exposure because we have people who want to buy this and stock this. And that is something that we want to deter persons against. You do not buy it and stock it. What we want is that we have some regular form of contraception, which is our plan A.
Yes.
Right?
And we'll be talking to Natasha about the plan A.
Yes. If one day all else fails, right, you come in for plan B. But we have persons who want to bulk buy, and we don't bulk sell plan B. By the way.
Okay.
So we have persons who want to, because we want to deter that. We have persons who want to bulk buy because why? You plan to be risque, or you plan, you take it before and you're thinking you're protected. No. If you have sex today and you're unprotected and you use a plan B and it happens again next week, this plan B does not protect you against next week. It's something that you use post. The issue. So hence why the name morning after. So once it's within 72 hours, whether sex occurred in the morning, in the afternoon, in the night, it will be, or that is the window that it can be most effective in.
And I have read that it's most effective in the first 24 hours, and the efficacy sort of reduces into that 72-hour window, but of course still works in the 72-hour period. So good clarification there. So morning after, it doesn't mean that if the sexual intercourse happened in the afternoon that the pill, because of the name, it will not work. So Natasha, I want to ask you, because Leona mentioned people coming into the pharmacy and asking, certain questions, what is it like at Planned Parenthood?
I'm listening to Leona and I'm like, okay, we have a totally different experience.
Wow.
I don't know, because they figure, because what I normally do, you come to the front desk, we deal with a front desk person who's a receptionist, and then we advise you to go to the nurse.
The nurse. Okay.
So most times, so they usually come in, and I have very, very young clients, like early 20s, because we cannot help anybody below certain age. So they come in like 19, 20, and they come in, most times the boyfriend and girlfriend coming together, and they come very shy, very quiet, and they come and they whisper it, and you can hardly hear what they're asking for. So we don't have the experience of the bulk buying and all of that. They come very shyly, and as long as the nurse is okay with them having, I hand them the glass of water, here you are, to help them out. So we don't have that experience where we actually have them on the shelves and they're there, and they expire on us. And I'm not sure if it's because, again, for us, we don't just sell it. You have to have a conversation with the nurse. So people avoid the conversation with the nurse because, like I said, we're not except for the nurses, and when the doctor is in, we're not medical professionals.
Right.
And then so somebody come, I can see the manager, please. I've had people who come straight to me. So when they come, I said, honey, man, I'm not a nurse. So you have to go, so we try to advise them too. I mean, if you come and you explain it was just the night before and the age and everything, I can. But normally I advise them to go, because the nurses also explain to them the efficacy, the way to take it, how often, and encourage them to go on some form of contraception.
Right.
So they would have, it's a different experience with us. There is the encouragement to go on something. There's the encouragement not to take too many of this. And so because especially if we have older nurses, and so they guide you into the process of being more stable instead of always having to have an emergency.
Definitely. And you see, the thing is, the conversation and the consultation is very important, which is why we also try to screen persons. So we've had a lot of people that we send your way as well. And besides just the emergency contraceptives generally, if you come in and this is your first time, we will advise that you go to your doctor,
professional,
a nurse, or Planned Parenthood, where you can walk in and get a free consultation about your contraceptives, because it's not something that we want persons to just take without knowing the risk the side effects, the how well are you protected, depending on when you start, you aren't protected, right? For the
That's
first 2
right.
weeks. So if you don't know these things,
Yep.
you get pregnant on contraceptives and then you're wondering what's happening. Was my drug, defective? But there's a lot of different reasons why contraceptives and the emergency contraceptive can fail. So the importance of having those discussions, is very high. So anybody that does have to come in and get contraceptives, don't be afraid, don't be shy. We got a lot of shy too. You might notice, a couple a little in the aisle, a ways away, having a back and forth discussion before one of them, comes to the
Come forward.
counter. But it's definitely worth the getting, overcoming the shyness to come and ask about it if you do need it.
And then, of course, from the conversation, I'm sure the listeners have picked up that the emergency contraceptive or the Plan B or the morning after is not a prescription medication. So that is why we're saying that people can come and ask, they don't have to have a prescription. So sometimes people, that is also one of the, the misconceptions. Some people think it's prescription medication, but it is actually not. It's just that the use should be guided. And as we're saying, you should understand when it's effective, why you should use it. And of course, when it is not effective at all, right? There is another myth I want to bring up, and either person can take this one. It's that if someone uses the emergency contraceptive method, their fertility thereafter is impacted, reduced. So sometimes people say, boy, you're using that, you're not going to be able to get pregnant when you want to get pregnant. This is something that is said. What is the truth on this one? So I'm putting that out on the table.
To both of us. Okay, so I'll start it off and then Leonel give you the medical, the pharmaceutical background. So even this morning before I left, I confirmed with our nurse. I said, Nasi, I know normally you don't encourage people to take too many of it. What's the whole thing behind it? Explain to me so that I can explain properly. And the thing is, of course, it's a myth that it will prevent fertility or it will make you infertile and so on. However, the thing behind it is that you're dealing with hormones. And that is what you need to be careful about. And so you pumping hormones, you're changing your hormonal balance, you're changing your bodies. What's the medical word for it, Leona? All of the, it's like you have all kind of imbalances and things happening. So the periods are going out of whack. So generally what is it is that it's not going to make you infertile. It's just that it's affecting your body's hormonal balances. Because you take too many of it. So you take it this month and you take it next month and you just keep taking and you just pumping yourself.
You're confusing the endocrine system.
Depending on when you take it. So all of these things, it will affect how quickly the period comes again. It will affect the heaviness. It will affect the lightness. It will affect if you actually see one in the month. So that is what you need to be careful. So not that it makes you infertile, it's just that it changes the hormonal balances.
Yes. And of course, your menstrual cycle is subject to changing with anything different that you do. I mean, women will know that, for instance, if sometimes you start an exercise program, you're exercising and you didn't used to be, you were not before, that can change your cycle, that can change when it comes and how heavy it is and that type of stuff. If you lose a little weight. So anything that shifts that hormonal balance, the body is so exquisitely designed. So for people like me that do biology, and you look at all the factors that have to come into play for a woman to have a menstrual cycle, which hormone has to increase, which one has to decrease, what has to happen. It's so delicately arranged that anything that you do differently, so for instance, taking that hormonal pill, the emergency contraceptive pill, it will affect the menstrual cycle. So we've addressed the fertility issue. There is not a reduction in your fertility if you use the emergency contraceptive, but there can be some change to your cycle in the next month or the month after that you have taken that pill. I don't know, some people have, for instance, missed a period after taking the pill, or had a very late period the next month. So I do know that has happened. Yeah. We had a question coming through. Leon, I think I'll give this one to you. Someone is asking if you have a chronic condition, for instance, systemic lupus, and you're taking medications for that. Can you take the emergency contraceptive to prevent pregnancy? So I guess, what is the efficacy if you are on other drugs? What is the efficacy of the Plan B?
The drug scene is so very large when it comes to Plan B. In the case of lupus or SLE, because of how lupus works and the systems that it can attack or affect, depending on how your liver is doing, depending on how, so that means your liver functions, your kidney function, all of these things would also come into play when we're thinking of if you can take any added form of hormone. Essentially, you might also want to stay away from progesterone with those conditions. So one of the safest ways in terms of SLE to probably deal with contraception might be to get an intrauterine device, one that is non-hormonal, like the copper IUDs,
yeah.
right? So the copper IUDs, it's essentially just a mechanism. So we're talking physics now, basically, but it's a mechanism that is formed to insert into the vagina to prevent, that conception, right? So that is one of the ways, or one of the things that you can obviously ask your doctor about if it works in your particular situation. But hormones wise, that's always something that you have to weigh, because there's a lot that the body is already dealing with chronic conditions such as those. I have some other ones that will come into play, because there's a lot of medications and actually a few conditions that affect how the emergency contraceptive or levonorgestrel works, how it is absorbed, how it is broken down, how it is cleared. And I actually know personal stories where persons who were taking contraceptives, whether they did an emergency one or they had a long-term, regular hormonal oral contraceptives, and they got pregnant and they were confused as to why. And when you review their medication, then you realize, there's a medication that you take in there. So for some people who take medications such as Tegretol or carbamazepine, you take that for seizures, you might be taking phenytoin as well, right? These drugs affect the metabolism of
what
of,
hormonal
the-
contraceptives of the Plan B?
of the Plan B, I'm thinking
Okay.
about, and
The hormones,
oral,
yes,
yes.
in there.
So the
Okay.
contraceptives, some of the
Yeah.
hormones in there, it affects, what amounts are absorbed by the body and actually used, right? So with those things and affecting how the levels are in your body, it's no longer a level that is enough. If I have to put it in layman terms, for it to prevent pregnancy.
Okay.
So you might have exposure. You take an oral an emergency pill the next day, but you're on and you have been long term on steady carbamazepine or phenytoin, or even some of the supplemental stuff. So if you take in St. John's wort that you can get on the OTC shelf, so those things you definitely have to ask your pharmacist about, on the OTC shelf. All of that can affect how that works, and lo and behold, ovulation still happens, fertilization happens, implantation happens, and there it is that you are pregnant. And besides the emergency ones, the ones that you take regular, if you have chronic conditions, obviously benefits and risks. So if you have chronic conditions where you require that you need to take Tegretol, then at that point you need to have a conversation, because oral contraceptives may not be the best form of contraception for you.
And not just oral, it could be any type of contraception, because for example, the implant and the emergency
Well, I should say
contraceptive-
hormonal. Right.
Because the
So-
implant and the emergency have the very same hormones. So you need to look at what hormone works best for you. So there's a thing where they come, oh, my friend is on this, and I come
And
on
I
that,
want it
and
as well.
then
No.
you have a very, very different reaction, a very different result. So that's why we always encourage people, you go to your doctor, go to the nurse, have the conversation, let them guide you as to what is best for you. Because I cannot review your medication. Your friend cannot tell you, if you're taking this, don't take that. If you're doing this, it's working for her. That does not mean it will work for you. Or it might work for you now, and any changes or any adjustments in your body, your age, menopause, premenopausal, perimenopausal, anything new, exercising, whatever, you find that sometimes the hormones are being adjusted.
Okay, so important, of course, to know, to discuss with a medical professional
that's correct.
what it is that you possibly are on in terms of other medications or supplements even, and of course what that would mean in terms of your choice of contraceptive method. And you started off nicely, Natasha, when you said that everybody is different. So there are different strokes indeed for different folks. We have gotten into a bit about the Plan A's, which we call the other forms of contraceptive
Contraception.
methods. We are saying here that the morning after pill is an emergency method. It is meant to be used sparingly in emergencies, but you should, if you're of reproductive age and you don't want to conceive, you should consider a contraceptive method that is your regular method, that is not an emergency method. Yes. So that's what we're saying when we talk about what's your plan A. So before you reach on a plan B, what are some contraceptive methods? And we can start with what's offered by Dominica Planned Parenthood. What are some contraceptive methods that a woman of reproductive age can consider?
So again, we have a few methods, and one of the things I've noticed, and I'll give Jolly's program, but not because we're on Jolly's program. I'll give them a book for this. Whatever we have, if they have it on the shelf, they got it from us.
Okay.
So Jolly's is not fighting and competing with us. Anything for us, what I've noticed with them is that whatever they bring in is stuff that we don't already provide.
Okay.
And so they get from us, they purchase from us, and then they offer it for sale.
Okay.
All right. So right now we have the pills. Generally, now I kind of like to just keep it in layman terms. We would have two kinds. We are missing one, so we're going to get it back very soon, which is the Microlute, and that one is normally given to women who are breastfeeding. The hormonal level again is the same. What's it? The
Levonorgestrel.
yeah, that one. I can't remember how to pronounce it. But
it's a progesterone pill.
Progesterone only,
so
right.
And the doses are lower. And so it's normally given to the women who are breastfeeding. So it doesn't affect the milk production. Then we also have the Zinnia, which is the more popular and more commonly used regular monthly pill. So you take your pills during the month and then this guides you. There are some people who use the red part, which is the iron pill, which are the iron pills. Some people, they cut it off for them. Again, it depends on when you want the periods to come, your iron levels and all of that. So again, like we always say, you speak to your medical professional, because I've seen the nurse sit down and cut it off and take off the iron parts. And for some people, she has to leave it and maybe give them another little pack to hold with them from, So then we have, of course, your injectables. Right now, we have three types of injectables. We have the Psychofem, which is a 1 month. Again, for some people, they don't want to go on anything permanent. They maybe just want something for an event, an activity coming up, or they want to regularly have the injection. So they do the 1 month one.
Okay.
We have the 2 month one and we have the 3 month one. They have, some of them have different hormones in them. Again, it's a discussion with the medical profession to determine which one works best for you. And then they would guide you as to how often you come, when do you start. We usually tell you start on your period. And so the nurses and the doctor, we do have a doctor who comes in on every other Saturday. So they would tell you, okay, this is not for you, this is better, take this one. So we have the pills, we have the injection, and then we have more permanent methods. So
before you move on to the permanent methods, okay, so your pills, your injections, those are hormonal contraceptive methods. And I do know that the decision between the two is often to, yes, you have to speak to your medical professional, but you also have to be very vocal with what is your general, what's your lifestyle type of practice.
Yes.
So some people cannot remember to take the pill. And so if you are if you're the type of person that you just, your brain is just too frazzled. Yes, you're not a person that can have that type of routine of taking something daily. Then of course the injectable might be more along the lines of what you would be able to do, because you don't have that everyday memory thing.
And not just every day, you also have to try as much as possible to take it at around the same time.
Yes. So your lifestyle or your personality, I would say, is also important in determining what contraceptive method is better for you, particularly when we're talking about the hormonal ones. Yeah. So the hormonals, your injectables, your pills, birth control pills, whether it's combination pills or progesterone only. And then Natasha, you're going to tell us about the permanent ones, the longer term ones.
No, they're all reversible, so they can be removed. But we have the IUDs. So again, we have the hormonal IUDs. These last up to 5 years. And then for people who don't want to have anything to do with hormones, or who would prefer not have anything hormonal, we have the copper T. So these last for 10 years. Okay. And you have the option of, you have it in, you feel like you want to take it out, you could take it out, replace it, you could take it out, change it. So it's up to you. You watch your body, you observe how your body is responding, and then you can always reverse the method and use something else.
And these two, they are put in the uterus. Yeah, so implantation is what is impacted a lot of times,
correct.
prevent implantation of a fertilized egg. And I would say too, once again, if you're talking lifestyle, people who have possibly maybe had children already, possibly in long-term relationships or marriages, whatever it is, may opt for longer term contraceptive methods like the copper T or the hormonal IUD. Well, that's what I have.
Well, not,
I have heard.
not necessarily though, because
Not all?
we do have quite a few young people coming
Young
in to
people,
put them.
okay.
But again, it's like, you put them in there and you forget about them.
Okay.
And again, your lifestyle. So
Yeah.
it depends on what works for you, what's easier. Some people are like, I don't want to go through the process because you have to. It's it's not surgical, but it has to go
To be-
it has to be implanted.
It has to be implanted.
But after a few days, the nurse will guide you as to how to take it, and then you ensure you prevent things again like yeast infections. You check on your hygiene. You check on what you eat. All of these things affect your contraceptives, what you eat, your hygiene levels, how you take care of your body, exercising or not. And the kind of lifestyle that you live. So it's
that is so
important.
interesting.
It's important to also ensure to remember that these are not, they don't prevent STDs and STIs.
Yes. This is so interesting. I feel like we're gonna have another show because Natasha, what you just mentioned about who is choosing what contraceptive method, I believe it shows a change in certain norms, and I guess that is why I'm thinking of a whole other show, because we can talk about the whole reproductive rate or fertility rate and the changes in what people want. Like, I mean, so what I'm saying that in light of you talking about younger people maybe opting for a longer term method. Where sometimes the concepts years gone by was younger people, that's when you making sure.
But remember, okay, so what about the case, for example, you're going off to study for 4 years?
Okay.
So I've had cases where nurse are going to be 4 years, simple and IUD.
Okay.
You come back after your 4 years.
But that's what I'm saying,
Yeah,
Natasha.
so-
You see that going to study, so people prioritizing certain
Careers and
things
studies and
right
so on,
before
yes.
you start thinking about. So that's why I'm saying the conversation on like the patterns in child making would be such an interesting one, because of course we've had all this talk about our birth rate is low. Not all this talk, it's a fact. Our birth rate is low, and so it would be very interesting to get that type of what has changed. How are people looking at making children now as compared to, let's say,
Before,
25 years
yeah.
ago? What is the difference in the thinking? But you were talking about the long term. You went over the IUD. What's next?
So, and the last one we have would be the implant. So
Okay.
these are implanted into the arm. The doctors would be a doctor, and we have a nurse who are qualified and
To do
certified
it.
to do them. Yes.
Okay.
So for now, we do have a number of other nurses who are trained,
Uh-huh.
but their certification is in process.
Okay.
But we have one nurse and one doctor for now. I'm not sure if there are other doctors who privately do it, but we have one nurse and one doctor that we know. So Dr. Shane McIntyre and Nurse Lambert. I think her first name is Laura, Nurse Lambert. These two, from what we know, are fully certified and ready to do it. So we do have clients coming in to get their implants done.
Implantable. Oh, okay. Okay.
And
I
you-
didn't
you-
know you offered that.
Yes, so it's a recent thing.
Okay.
We did train a few other nurses in the health centers. So like I said, most of them are almost ready. They're almost ready with their certification. So maybe just a few more practice sessions and so on, and they'll be there. So it is going to be offered in the health centers, but we also offer it right now. We are ready. We have them available. And so if somebody needs to get an implant done, they can come in to have the nurse or doctor
And as
insert
you
it.
as you
That's
mentioned, the
new.
implant, that is one of the things that the persons with lupus, depending on what your condition is, that's one of the things that you can possibly ask about as well.
Okay, the implantable, the implants. Oh, okay. So you see, that's new information from Planned Parenthood, that is being offered. So you went through. So this is what you'll have: the birth control pills. You went through the two, or the three types that you have. The
Yeah.
three. Then your
Injectables.
injectables. and then your IUD
And your
and your
implants.
implants. Okay.
And remember, they're all reversible. So at any point in time, it's not working.
Mhm.
Something happened, a change of
You
lifestyle.
can remove.
Or like, okay, I didn't want to have children, but you know what? Like, it just come creeping
Yeah.
up on me.
Yeah, you
Let's do
met
this.
the partner of your dreams. And now you
Yes,
have
I
to-
changed my mind. I
you
want
know?
to.
You know, they are all reversible.
Yeah.
Okay.
Simple, it's not nothing, no life-threatening procedure. They're very, very simple procedures,
Mhm.
of course, but they have to be done under sterile conditions. And
Okay.
the doctor and so it's not a thing where you just go at the women fancy, just get it done. Go to the doctor, go to the nurse. But the access now is what is most important.
And
They
it's
are all
available, right?
Okay. We have barrier methods as well. I mean, for both. So we're talking here strictly
Mhm.
contraceptive
Mhm.
methods, but of course, barrier methods can be contraceptive, but also help with the STI
STI prevention.
prevention. So you all
So
do
we
still
have
the condoms,
yes.
male and female.
Male and female.
Okay.
And if some of them with the female doesn't go much because I feel
Mhm.
like there needs to be a bit of a buzz about it and some more conversation about it. Maybe a few people need to
And
try
the,
it and
the
talk
how
about
to
it.
as well
And
is
the
a bit
how-to.
more of a thing.
Yes.
The
the
nice thing
incision.
about it though is that you could put it in before.
Mhm.
Yeah.
And you can, you go out to party, you put it in before and you're ready at any point as compared to the male one where you have to actually put it at that point.
Mhm, mhm,
And
mhm.
so, but the barrier methods are very, very important because one of the things I found is that people, like I remember going to a Creole festival one year and we were pushing the condoms and
Mhm.
most of the girls were like, no, I don't need that. I'm on my birth control. And they
Exactly.
were very young and it left me a little bit concerned, honestly.
Mm.
And it's a whole year later from that particular Creole festival that I went to pushing them. And it still bothers me because I'm like, we're very concerned about not getting pregnant, but
We're not
we're
concerned
not
at
concerned
all.
about our
Mhm.
STI and
STIs,
infection
mhm.
rate. And that is one thing that we need to be very careful about. They are real, they are existing. We do have
Mhm.
people with HIV.
They're
and
rising
we
as
have people
well.
with- and what happened, what I realized is that when we were younger,
Mhm.
the buzz about HIV in particular, HIV, it was a big thing. But we no longer have all of that we don't make that much noise about it anymore. And so the younger people who are coming up, yes, they know about it, yes, they're aware, but the level of concern is
Mhm.
not there. However, when we were younger, it wasn't as bad because it was a new thing they were making. But right now, I feel like we need to push it a little bit more and start educating people so that they can be a little bit more careful and make responsible decisions.
Right. We definitely see that in the pharmacy as well. I can say that when we talk about condoms, sale has declined now as opposed to how it used to be back then. And it's something that is crazy to think because I think most people do know that contraceptives do not prevent, STI infection. But for some reason, we just don't, or we're not generally concerned. So, like you say, you ask a young person, and all they care about right now is
Not
getting
having-
pregnant.
not
Because
having babies.
if I get pregnant, my lifestyle has to change. Most people, that's what you hear from them. And I don't want my lifestyle to change. I do not want to be. You might hear people telling you they don't want to be tied down or they don't want to be under financial burden. But really and truly, when we talk about STIs, infection, depending on what you contract, that is a financial burden by itself. So you
Of
should
course.
definitely look at it as something. And besides financial burden, you have persons, you psychologically that is a burden to bear until you get to the point where you're probably okay, But definitely the spread of STIs and STDs, you see it, persons making decisions now that might be more risque, which is why, for instance, we might more likely want to be on long-term contraceptives. So if you know that, your lifestyle might, give you room for being exposed to these type of things, then definitely don't knock off condoms, even if you are on oral contraceptives, or if you do not have a long-term partner, and you are sexually active, condoms are your best bet
Definitely.
at preventing pregnancy
And
and
STIs.
protecting you from
STIs.
whatever might be, in the population. And there's a lot in the population. A lot of times we only think of, the big ones. We might think of HIV, but HIV, they say no,
The
everybody,
syphilis,
you alive and you're
Yeah.
okay. So for the most part, we don't worry about it too much. But there's a lot of different STIs that we see. And we do travel persons, so there's nothing that cannot get here, in terms of STIs and so it's something definitely that young people need to take note of.
And even with that, one of the things I would do advise people to do, you have been exposed or you have unprotected sex, go to the nurse. Because sometimes a simple thing as a little irritation, a little itch. can prevent, and you go to the doctor to get something simple, or you go to the nurse and they give you whether it's something oral to take, or they give you some medication, can prevent it from going further. So as much as you need to be very responsible, however, when there's a possibility that you might be exposed, go get tested.
Definitely.
Go get checked.
Definitely.
Go visit the doctor, go visit the HIV unit.
Yes.
Do something. Don't
And
just sit back
with
and be,
HIV,
concerned.
with HIV, you have a very small window. So essentially, if you're exposed to somebody that you don't know their status, you think they might be HIV positive, or unfortunately there was a situation that involved abuse, definitely get yourself to the HIV unit or the health center, and that would be the Roseau Health Center, particularly as soon as possible, because there are forms of prevention if you have had some form of transmission, but it's a very small window. So if you do have let's say intercourse with a person who is HIV positive, right, and for whatever reason, however this occurred, if you go to the health center, so like the Roseau Health Center or Dr. Peters or Dr. Joseph, I believe these two, then you can get some form of prophylaxis, which then can prevent you contracting HIV, even if you've had, let's say, fluids which contain the HIV virus in it, right? But you have a small window. So sometimes we just need to take charge of our health and our own decisions, and whatever circumstances that may come through that expose us to these things, that we know, or we have the knowledge, or we know where to go to possibly, stop the contracting of those lifelong conditions.
That's very important information, Leona. I mean, in terms of prophylaxis, I didn't know the Roseau Health Center had that available. And you mentioned 2 private doctors?
Well, I believe there's only a few who can dispense to you. I know that Dr. Peters is in charge of that. So she's one. I believe Dr. Teresa Joseph is one as well. The Roseau Health Center is where the medication is dispensed out of. Right? But essentially, if you have an emergent, well, it will always be emergent because it's always short timing. You can go to the casualty and they can deal with that from there as well. Whether or not you get the prescription from there and you have to pick up the medication at the Roseau Health Center, because that's where most of it is. But you can go to the casualty, or you can seek out one of these doctors. If, for instance, say it's on a weekend, or you don't know the doctors, you don't know how to find them, take yourself to the casualty. That's all.
Okay. So just some, information here as it relates to prevention of STIs, STDs. I mean, I know we're talking pregnancy prevention, but it's important to kind of segue into that, because it's all part of the same process, which is sexual activity, and that's the risk that's associated there. There were 2 questions I wanted to take here for Jolly's Pharmacy specifically. One of our listeners is asking about the availability of dental dams at Jolly's Pharmacy, of course, for prevention of STI transmission during oral sex. And then someone asked a little earlier about a hormonal method that is specifically for acne reduction, so people can take. I cannot get the name. If you can, right? So they asked about Occutone for the acne prevention. So Jolly's, what's available?
They asked about Accutane. Yes, we do have Accutane available in pill form. We also have like the tretinoin cream that you can use in terms of topical form. So that's definitely something that you can have a discussion with your doctor about. So long as it's prescribed to you, we have them available in the different strengths, so you can get that treatment definitely. And that is, again, almost like a show by itself, because acne is a big topic, and that's one of the things that works really well for it. But definitely with that drug, after it's prescribed, you need to get information on it, consulted on it, because there's a lot of effects that it can cause too. So it's something that needs to be controlled. In terms of the other question, where
dental
dams, we do not keep dental dams on hand, but it's something that we can possibly bring in. And that's one thing I want to tell our listeners as well. A lot of things, if you're not sure, come to us, ask us. We've brought in stuff that we don't usually have. If a person does need it, if they require it, if they have a prescription for it for some items, because what it is the majority of the population does not use it. So us bringing it in,
Yeah.
would defeat the purpose. However, if we have someone who needs it, so long as we can source it, then we can do that for you. So
Okay.
you can come into the pharmacy, any one of our locations, and ask about the dental dams, or give us a call at 448-3388 and speak to a pharmacist or a pharmacy technician. We can take your information and let you know if that is something that we can get for you.
And I mean, we are almost at the end of our time. I want to, Leona, I'm going to give you the opportunity to talk about this last thing that you have for us, but I just want to talk about the access of certain contraceptive methods at the pharmacy level. Of course, I know how it is at Planned Parenthood in terms of, Natasha has said, you come to the front desk person and then you will be led to consultation with the nurse before a contraceptive method is given.
Or the doctor.
Or the doctor, if it's the day that the doctor is there. But Leona, for the pharmacy, I know we have people who are, I want to say, embarrassed about asking for certain things at the pharmacy. What is the process like if you want to get your birth control pill, you want to get your, the emergency contraceptive, the Plan B? Is it ask at the counter? Is there any kind of aspect of privacy? What is that like, and what is your experience with that with the customers?
Okay, so a lot of things, but I know that most of us, if we're not shy, yes, we're embarrassed. So we feel like we've been irresponsible sometimes, or we feel like, well, I'd have to.
People will
a lot
say,
of people might hide it. So we might get people coming in who come to the counter, which you can, and they'll come in and they'll say, I want what's that thing name again? The thing I peel, but what she sent me for that for now, what she tell me to buy, and sometimes it's for themselves, and you really don't need to put on the show. We work in this
Just
every
more
day.
attention though.
Right. So we work in this every day. We know what it's for. We know why it's used. We understand the importance of it when it's needed. So we are the least persons you need to worry about in terms of judging you for the process.
It might not be the judgments of the pharmacist, but the people
it's
around. That's what I think.
Definitely that thing. And even when the line is completely empty, I think it's a social thing as well.
Okay.
So then you have the whole, it's okay. You come, you ask us for it, and that's fine. You'll never get us, laughing at you or anything like that. It's fine. That is something that you need, and it's better you come in and ask for it in the time that you need it. Now, if it is that you're on the shyer side of things, or you do not understand the medication or how it works or what you need to do, or if you're within time, you can always come up to the counter and ask to speak to a pharmacist.
Okay.
Or ask to speak to a technician privately. Tell them you like to have a private chat. Nobody around you knows what you're asking about. And at every of our locations, we have a consultation room that is available, or private space that you can come into and speak one-on-one to the pharmacist, one-on-one to the pharmacy technicians. Either of each can, give you more information on the drug itself, right? Now, what I want to sensitize persons about is, if through that conversation we direct you to your doctor, it is not because we do not want to sell it to you. It is not because we want to put you at risk or make more of your 72 hours pass. It's because we want to ensure that you are properly protected, whether it be, your conditions are gone through, your medications are gone through, you get a thorough understanding of the drug and what you're doing and what you're taking, and possibly, a bit of consultation about regular contraceptive use, which sometimes might be difficult for us to break down into in the pharmacy. We will direct you to a doctor. So either way we go through it, you can get a private consult. You can come to the counter by the pharmacy tech and ask for it. Or if you know exactly what you want, you're on it already. It's not like it's a prescription or whatever the case may be that you had. You can go to the cashiers and just tell them the name of your drug. What I would want to tell people is, please know the name of your drug. So essentially, if you come in and you didn't have a prescription, so I can't search it and see what you were on, if you can't remember the name of the drug, hold the old card or hold the box. Take a picture of it. Right now, we all have phones. But it's important that you know, because what's going to happen is you have Microgynon this month. You come in for a contraceptive. You tell them you want one. Now, if we know you don't know the name of your drug, and we show it to you and you can't pinpoint, we will ask you to see the doctor.
Okay.
Right? So you need to know what you're on and what you're taking.
Okay. Are contraceptive methods, I mean condoms as well, barrier methods, are those available for order on jollies.dm? So can a person order these contraceptive methods?
What I will say,
Mm.
if we're talking about the barrier methods, these ones, and we often ask that you have some form of prescription with the barrier method simply because they have to be put in there by
No,
a
like your
Your condoms.
Oh,
condoms.
your
Your
condoms, of
condoms.
course. You can buy your condoms. You can get your condoms on the site.
Okay.
Your condoms. But
All
when you're
right.
talking about any of the hormonal
No,
stuff,
no.
yeah, you come in.
I was talking
Okay,
about
okay.
the barrier, your
No problem,
condoms,
no problem.
male condoms.
They're
Yes,
available
yes. That
on
too. Some
site.
people may be embarrassed to pick up in the
Mm-hmm.
pharmacy. So, if you can order it, that's a good service. All right. So, yes, Leona, you had something to conclude with.
I will try
We're
to
wrapping
go
up.
through this pretty quickly. So
Mhm.
basically, just a few situations where you might think that you're protected and you're not, or a few situations where you should understand that knowing what the emergency contraceptive pill will help you better than being ignorant about it, right? So we have persons who are provided with a false sense of security, right? So for instance, you had Plan B regularly. So you take it all the time when you miss and you figure you are secure. After ovulation, it didn't work. Essentially, you were hoping that you knew more about it, but Plan B only works after the egg is released, and that's something that we know. So if ovulation already happened, then emergency contraception cannot work. Emergency contraception is a backup, not routine contraception. And so you can still have pregnancy scares. You still have side effects from there. So one of the side effects that we didn't mention might be nausea,
Cramping.
fatigue, cramping, all of these things. That's really unnecessary. So if it is that you find yourself in this situation regularly, you're giving yourself stress, find a way that works in terms of a regular oral contraceptive. Ladies, we are the ones taking these pills, and not our partners. And sometimes we have to stand up for ourselves because a lot of time you find that a lot of women are pressured into taking emergency contraceptives. Because why? The man wants to enjoy himself. He wants to enjoy himself this week. He wants to live freely next week. He wants to live freely the week after, right? You are the ones taking these hormones. You are the ones getting the side effects. You are the ones, potentially putting yourself at risk, right? And so you need to have a conversation with your partner about barrier methods like condoms. It's not a one-way street. You are both responsible for that. Persons who have conditions, chronic, like Crohn's disease or any condition that deals with absorption of the digestive system, that slows down absorption, that can affect how contraceptives work. And so the contraceptives the hormone might not be as effective for you, and you can still get pregnant. Persons who are on drugs, like I said, carbamazepine, certain anti-seizure medications, a lot of drugs actually can affect, how the drug works and the levels, and you can still get pregnant. If you have a high BMI, so if you are overweight, you have a high BMI, in terms of how the drug works, the efficacy instantly drops for you as opposed to somebody who is of a lower BMI. So all of these things can ensure that it doesn't work. If you vomit within 2 hours of taking the drug, you're going to need another one as well. So it's a lot of different things that you need to know in terms of taking the emergency contraceptive to know if it works or if it hasn't worked.
Okay. So nice summary there of some of the things that we have discussed and some of the things that are important for you to remember. Natasha, I want to give you the opportunity to close, sharing some information with us at least about where is the Dominica Planned Parenthood office located for people who don't know, for people who don't know that you've moved, and what is your contact information, of course, because you do provide these essential services that some of our listeners maybe, can come to you for. So what's your location right now, and give us your contact.
Okay, so unfortunately, we have moved, and quite a few people are still trying to figure out where we are. It's
Right.
almost 2 years since we moved, and people still having difficulty finding us. So we are directly behind Whitchurch, and we are upstairs of Bloombox.
Okay.
So if you come to Western Union, there's a little alley. HIV unit is on the other side. V-Scuture is right next to us, and we're right there in the small building upstairs, directly upstairs of Bloombox. All right. So our contact number is 448-4043, and we also have cell phone access, and that is 275-6848.
Okay.
Now, one of the things, even before we go, that I want to really push is that it's important for our cell phone number needs to be a big thing for us now, because we are beginning to offer new services where we want to go into e-health, and people can actually call in. So you see, like before, you cannot just walk in, you cannot just call over the phone regularly and ask, can I get my dates? But you can call video call, because I can see you. The important thing is that I can see you, and to give you a date, and I know I'm speaking to Trudy. Trudy can confirm all of her information, and I can see Trudy confirming her information. You call on the WhatsApp video, and it makes it easier than having to walk all the way, because we cannot give it to someone, an anonymous person.
Okay.
So also we're looking into providing online counseling, and so you have to send a message to the number. There's a QR code, or you can actually call the number. And we have Lester Guy, who is a counselor. He's also into like HIV. He has like a wide range of areas at his service. And so Lester has teamed up with us to now provide online counseling service.
Very nice.
We can do it in person, but if you want the online service, it's $80 a month. And so from January, that would be our new service, in addition to having Dr. Shane McIntyre with us every other Saturday.
Very nice, very nice. So new things coming up, and I think very, very useful, very needed. So the online counseling option coming up, and Lester Guy, of course, well known here on the program, and of course your e-health options. So repeat that cell number, Natasha, because people need to save that. So if you're listening to the program, you need to save the cell phone number for Dominica Planned Parenthood. Go ahead.
So it's 275-6848.
275-6848.
And you can still call the office 448-4043, but it depends on what you want. We may not be able to necessarily serve you, to give you dates and so on. But the WhatsApp thing, a video call, making it much easier for you. So 275-6848 to call in for any of your medical needs.
All right. I'll also pin that in the chat on the social media platforms of Q95. But it has been a very full conversation this morning. Ladies, thank you so much. Natasha, thank you for taking the time to join us here on Health Vibes. We are ending this program. I do know that we did not get to take some of our calls. I apologize. And I guarantee you that next week, maybe because we are going to go into a discussion next week that might be along some of the lines of what you heard today. So you might get that opportunity next week to dialogue with us. But until then, I wish you all a very good week, a healthy week, a safe week, and stay on the lookout for our return next week, Wednesday, to the program Health Vibes, where we always give you a little vibes with your health information. Have a good week. Goodbye.
Joyce Pharmacy is bringing vibes to health with Health Vibes. Health Vibes. Each and every Wednesday from 10 to 11:30 a.m.